That the motion be agreed to. The honourable member for Rosevears.
Thank you very much, Mr. President. While I was door knocking during my election campaign, the beautiful part of Rosevears, Grindelwald, quite quaint and peaceful part of the electorate, I knocked on the door of Scott and Katinka Hudman. At the time, our conversation was totally based around voluntary assisted dying, and Katinka shared with me about her mother's journey in that space. Since then, we've exchanged a number of emails, and the issue of medicinal cannabis has come up. Now, it hasn't come up just out of interest on the matter, but out of desperation for Katinka, who has MS, to stop the constant spasms that occur throughout the day and indeed keep her awake at night. And I can certainly relate to this, Mr. President, having watched my own dad suffer from very painful spasms, also as a result of MS. It was a daily task where he would yell out from his chair or his bed for my brother and I to run to him to push his foot against the spasms to try and stop the pain. So I contacted Katinka and I asked her if I could share a little bit about her story in this place today, and she agreed to that. In 1992, at the age of 42, Katinka, a registered nurse of over 20 years' experience working in rehabilitation, was diagnosed with remitting relapsing multiple sclerosis. And like many MS patients, her disease progressed to secondary progressive MS. So what that means is that Katinka is steadily and slowly deteriorating without any possibility of recovery. We move forward now some 2 decades, and this is a snippet of her daily life, her daily challenges in her own words. I have learnt to live with continuous pain, spasms, fatigue, incontinence, and severely reduced mobility. I've learned to cope with my ever-changing limitations with the use of scooters, splints, incontinence aids, and many adaptations to daily living arrangements requiring walking frames and learning to accept help. Now, Katinka has been very clear in what she has sent to me. She is not looking for pity. She does not want or need pity. What she says she needs is help to reduce the intractable nerve pains and spasms, especially in her legs and feet, because she just can't sleep. Her nights are continuously broken by pain. Now, the only time in Katinka's life where she has found relief was a period of time when she lived in Europe. Here, she was able to access medicinal cannabis through the Netherlands MS Society. Unfortunately, after she moved, this was no longer available to her, and she recommenced taking numerous drugs to try and maintain some quality of life. Mr. President, the list of drugs is quite long, and to be honest, I actually can't pronounce half of them. The only drug that actually stood out to me was baclofen, which was indeed a drug I remember hearing as a child that my father had indeed used. I understand this is a muscle relaxant, an antispasmodic agent, and the side effects can include daytime drowsiness, nausea, and issues with bladder control. After Katinka shared her story with me, I contacted our Health Minister, Sarah Courtenay, to ask where the government was at with medicinal cannabis and its availability in Tasmania. The Minister responded to our request for help in this area, setting out the pathway for Tasmanians to access treatment with these unregistered products. And the Honourable Member for Windermere has already touched on this process, but I would like to refer to the response that I did receive from the Minister. It begins with a general practitioner consultation, then a referral to a specialist medical practitioner in a relevant field of practice. Public health advice has consistently been that the safest and most responsible way these products can presently be prescribed is through a specialist referral model. This ensures the management of their condition is optimised with existing proven therapies before resorting to unapproved medical products, and the member for Windermere touched on this. This is established clinical practice pathway for assessment of any treatment of a refractory medical condition, not just unapproved medical cannabis products. Once the specialist medical practitioner considers an unregistered medical cannabis product is safe and appropriate for the patient, They then seek legal authority from Secretary of the Department of Health to prescribe, and it's reviewed by the Tasmanian Medicines Access and Advisory Committee. Now, for Katinka, unfortunately, she hit a hurdle at the very first jump. Katinka told me her GP was unable to help her in this space. So for her, her journey continues. And tonight, again, she will have a night with broken sleep. All medicines can be used for good or for bad. Endone, a highly addictive painkiller, and yet at times it's the only way my mum can actually control the extreme pain in her leg following her hip replacement surgery. Pseudoephedrine, used in amphetamines, great as a nasal or sinus decongestion, also found in numerous filthy party drugs. There can be great goodness and certainly relief found in medicinal cannabis products. I am pleased the Tasmanian Government is continuing to diligently and carefully move in this space. In 2016, the Tasmanian Government commenced the Controlled Access Scheme, which the leader spoke about, allowing relevant medical specialists the option of considering unregistered medicinal cannabis products. The CAS is not condition specific. Any relevant medical specialist practicing in Tasmania may make application if the illness or condition has not responded to conventional therapies and it's considered by the specialist that the use of an unregistered medical cannabis product is safe and appropriate for the patient. The CAS continues to support the safe and responsible use of unregistered medical cannabis products informed by evidence and expert clinical advice. I, of course, deeply sympathise with Tasmanians suffering chronic and challenging medical conditions, and I acknowledge the struggle that they face on a daily basis. While the government doesn't support the motion, it has been noted, and the Minister for Health and the government will continue to work to improve health services and to do all it can to support our fellow Tasmanians. And I will be watching closely and supporting the government's movements in this space because I believe Tasmanians are counting on it. Just before I sit down, I have one more answer on behalf of the leader. This is for the member for Murchison. The question was in regard to ministerial influence on TMAC and the list of memberships. The TMAC provides clinical advice based on their relevant expertise. The committee membership is based on the specialties required for the application and may change depending on the expertise required. The care membership is made up of representatives from infectious disease, oncology, haematology, psychiatry, gastroenterology, rheumatology and paediatrics, as well as specialist pharmacists and consumer representatives, which reflects the scope of applications routinely assessed by the committee.
The ministerial interference?
Beg your pardon?
Because you're going to talk about the ministerial control or input.
Just through you, Mr. President, we're not able to answer that at the moment. I'm sorry.
The question is that